Hello everyone and welcome to our first aid webinar. Just a quick reminder that this talk will be recorded alongside all the other talks in our series, and they are available on YouTube. If you have any questions during the talk, there's a little Q&A box at the bottom of your screen where you can submit any questions. We will ask some of them kind of during, but the majority will try and ask at the end. If you've got anything urgent, do just put it in that chat at any point. I'm sure lots of you have already met Helen. Helen joined us just October this year. She originally did some work for Spana, a charity abroad, and then was an intern at quite a busy equine hospital up in Yorkshire. She's got a really keen interest in emergency and critical care, and that's obviously very relevant to tonight's talk. So without further adu, I'll hand over to Helen and let her begin her webinar.
Thank you very much, Linnea. Hello, everyone. Welcome to the talk. I hope you find it interesting and informative. As Linnea said, any questions, do feel free to ask them for us. So, just as an overview of the talk, so a talk outline, we're going to start by talking about how to assess your horse's vital signs, what's normal and abnormal, etc. We'll then have a look through multiple common reasons why an owner may think their horse needs veterinary attention. In an ideal world, this sort of talk would be very practical and hands-on. However, of course, that hasn't been possible this year, but perhaps if people are interested, then at a later date, we might be able to do something a bit more practical with everyone. Just, demonstrations of kind of what we're talking about. But we'll do our best today. So just as a quick warning, there's no particularly graphic images, but there are a few ones with some blood and some wounds. So just to let you know that those will be coming up. So, how to examine your horse. A heart rate is most easily taken from the left side of the horse, just behind the elbow, if you happen to have a stethoscope. Heart rate should be around 36 to 44 beats a minute with a regular rhythm. However, this can vary if your horse is stressed or excited. For example, if we come to listen to your horse's heart for vaccination, it'll often be elevated just because they know what's coming. So sometimes it's worth taking it once or again a few minutes later. If you don't have a stethoscope, as most of you probably won't, you can take a pulse rate just from under the mandible. It can be quite difficult to feel sometimes, even in a normal horse, so you shouldn't panic if you can't find it, but it's something that if we're ever looking at your horse and you'd like us to demonstrate, you can always ask us and we can do that for you. You count it exactly as you would a heart rate and you're still aiming for 36 to 44 beats per minute. What we usually do is count for 15 seconds and then times it by 4 to get your beats per minute. Heart rate can vary for a few reasons, including exercise, stress, excitement, pain, or in severe circumstances can be an indication of inadequate blood volume. So that's heart rate. Respiratory rate is usually around 8 to 15 breaths per minute. This can be quite difficult to assess sometimes if a horse is just breathing normally. It's usually quite shallow breaths. So you really just need to watch their flanks and count how many per minute. If you watch the nostrils, any nostril flaring is abnormal, and any increase in respiratory effort, the horse really trying to breathe, is also abnormal, and you should contact your vet if you're concerned about this. Temperature is taken with a thermometer that you could buy from any pharmacy. They're really handy to have around on the yards. If we speak to someone for advice, we'll ask them if their horse has a fever. So if you have one on hand, it's really helpful for us to know that. What we count as normal is around about 37.3 to 38.4 degrees Celsius. Anything above 38.5 is counted as a fever in our opinion. This suggests some sort of inflammation in the body, usually caused by something infectious like a bacteria or a virus. Not always, there are some exceptions, but usually there's something else, some sort of infectious agent present. Mucous membranes, finally. So mucous membranes can be checked just by parting the horse's lips and assessing the colour of them and the moisture of them. Pale pink is normal. I've got some pictures on the next slide for you. Pale pink is normal. Very pale can be caused by blood loss. Yellow mucous membranes by severe liver disease, and bright red or purple mucous membranes by severe systemic illness, where blood is not being distributed around the body as it should be. When subtle changes are present, sometimes these are quite hard to interpret. And every horse is a little different. We do see a lot of variation. Some horses will have natural pigment on their gums as well. But any major change is definitely of concern. So if you notice any of these are abnormal, then definitely worth the ring. Usually if these are abnormal, then your horse will probably be demonstrating other signs such as colic, or they may have diarrhea. So usually that wouldn't be the first thing you noticed. Couple of pictures for you. So on the left-hand side here, these are nice mucous membranes, the normal colour throughout, pale pink. And when you touch those, what you do is you press down with your finger on the gum until it goes white, and then you count how many seconds until it turns a pink colour again. And that should be about 2 seconds in the horse. Obviously very different on the right-hand side here, very dark coloured mucous membranes. This is quite an extreme example, and the horse would be sick. You can see the abnormal colour present there, and you can slightly, if you can see my cursor, you can see this sort of purple outline just around the teeth there. That's something we sometimes call a toxic line, which really indicates that the horse is unwell. So now we have just talked about what's normal and abnormal in your horse in general. We'll start on some specific parts of the horse, which often we'd have call-outs for. So starting with the eyes, horses are very good at injuring their eyes. They're very prominent, and of course they're on the sides of their heads, so they're quite prone to damage. In a normal horse, both eyes should be wide open. If you're unsure about one eye, then it's helpful to look at the other. If you look at the eyelashes, the eyelash angle of both eyes should be the same. If one eyelash angle, if on one eye the eyelashes are pointing down a little bit more than the other side, that means your horse has a painful eye. They'll be quite good at hiding pain, so it's important to look for the subtle signs. The surface of the eye should be shiny with no opaque areas, and the conjunctiva around the eye shouldn't be red. It should be nice and pink. There should be no discharge from the eye, and the eyelid shouldn't be swollen. So just here you can see the pupil, the iris. Your third eyelid lives down here, and of course the eyelids are not swollen, no wounds or any discharge. So the abnormal equine eyes are really sensitive in the horse, so any swollen, closed or even partially closed eye is an emergency and requires veterinary attention. My advice would be don't apply anything to the eye without first seeking advice, and if you're concerned, then bring your horse into a stable away from bright light until you've spoken to us. Just a quick overview of some causes of ocular pain in the horse. Trauma is really quite common. They'll be out in the field, they'll hit their head on something, or they'll go past a tree and they'll get a scratch from a branch. And what we'll often do to assess trauma is, you may have seen us pop a stain in your horse's eye. It's an orange dye that we put in, and if the surface of the eye is damaged, the cells underneath take up the stain and it turns green, as you can see here. So this is what we call a corneal ulcer. This whole green area is ulceration, where the surface of the cornea has been lost. The horse has probably scratched it on something, or has hit it on something, or there may even be a foreign body under the eyelid somewhere that's causing trauma to it. So that's quite a common thing for us to do when we come out and see the horse. Other causes of painful eyes is something called uveitis, which is inflammation of a specific part of the inside of the eye. This is probably less common than trauma, and it may affect one eye or both, but often your horse will have a sore eye if this is present. Briefly mentioned already, foreign bodies. There's underneath the eyelid, there's quite a space that can hold anything really, bits of hay, bits of tree, small amounts of grit or anything like that can get stuck under there and cause recurrent ulceration on the eyelid. Of course, there's also the third eyelid that we can pop out when we examine your horse's eye and just check there's nothing underneath there. And then eyelid wounds are a really important one as well. If there is a wound to the eyelid, it's really important that we get these stitched, especially if they communicate with the eyelid margin. So if they come right down to this margin here, it's really important that they're stitched in a certain way, so that so basically you want the eyelid to be one continuous margin. If you have a wound and it heals back with some scar tissue or with a slight irregularity, then it's prone to causing abrasions on the eye at a later date. So it's really important these are stitched so that you get your nice smooth margin back afterwards. So as a take home for the eyes, pretty much if you have a concern over your horse's eye, it's definitely worth a call. They can get worse quite quickly if left alone. So even if you just want some advice from us or want to send us some pictures or anything like that, feel free to contact us. Okay, next is lameness. Other than colic, lameness must be one of the most common causes of problems in the horse. Lameness may be subtle or severe. By severe, we mean noticeably lame at walk, inability to put a limb down, walking on the toe, etc. Lameness is that are only present at trot, and the horse is otherwise bright and well are not usually emergencies, but probably will require our attention at some point, but usually not as urgently as those that are really sore at walk or are distressed or can't put their foot down. So if you should call us saying your horse is really lame at walk, can't put his foot down, won't move, we usually think it's caused by one of the following. These are the most common things that would cross our minds: foot abscesses, fractures, septic joints, cellulitis, foot penetration with a nail, or laminitis. Callers will usually suggest you try to move him to a stable or a clean environment to facilitate our examination. However, if anything you tell us over the phone makes us think fracture, then we may suggest you stay where you are. So just going to spend a little bit of time on this section talking through each of these in turn. So first of all, foot abscesses. These are really common. Often you'll leave your horse in his stable one evening, but when you walk him out the next morning, he struggles to walk. Typical foot abscess. This is caused by formation of pus underneath the sole or the wall of the hoof, usually secondary to bacteria, moving through a defect in the white line or a puncture in the sole. Horses with crumbly or poor foot quality may be more prone to these. So when your horse has an abscess, he'll usually have a hot foot and an increase in digital pulse, which can be felt in the areas shown in the diagram here. This does take a bit of practice, so it's a good thing to check in your horse regularly, see if you can find it. And again, this is something we can show you if we're ever at your yard for any reason, just ask us to demonstrate. These do require veterinary attention. They're very painful. The horse may well be quite distressed with it, and it's vital that we are able to get to you and help them. In some cases, we'll be able to pinpoint the location of the abscess, dig the sole with a hoof knife and release some pus. In others, it may not be accessible and may require poulticing to help draw the pus out. Depending on the location of the abscess, it may burst out via the sole or via the coronary band with some time. However, regardless of this, your horse will need box rest and poulticing until the pus has stopped draining. There's just a few notes here about how to place a poultice. So you want some poultice material first, soaked in warm water, and then some padding such as a nappy. A nappy is a really good one, or some soft band or some cotton, and then some vet wrap, some waterproof tape, and it'll just need changing once or twice daily. And here just shows some examples of the stuff we might use. So some poultice material first, a padding layer. We don't usually use cotton, but something more like soft band or a nappy, and then just a vet wrap and some duct tape. So that's foot abscesses. Fractures, of course, fractures, worst nightmare. Sometimes this is very obvious, unfortunately not always. It depends on the type of fracture, which bone, how it's happened, if it's stable or not. Your horse will likely be lame, usually very lame. The limb may look an abnormal shape. There may be an area of localized or diffuse swelling with pain on palpation of the area of the fracture. The horse may well refuse to move, and there may or may not be a wound, depending on what happened. They will often be very distressed as well, so they may sweat and shake, which will be quite noticeable in most cases, especially if the fracture's unfortunately a severe one. On assessment of your horse, we'll try, of course, and get there as soon as we can. We may take radiographs to confirm the fracture and assess it in more detail and see if there's any possibility of fracture repair. If not, of course, then the best option is unfortunately to put the horse to sleep for welfare reasons. If the fracture is stable, so that the bones are able to sit together in a normal alignment, and repair is a possibility for the horse and for the owner, then a Robert Jones bandage, as above, will be placed to act as a splint, and your horse will be referred for specialist attention. A Robert Jones bandage is basically a very, very thick bandage that has multiple layers applied to increase support around the limb. And yeah, if there's any concern over that, actually, don't try and move your horse to a stable, just leave him where he is and we can come to him. So next cause of severe lameness is something called a septic joint or septic tendon sheath, also known as synovial sepsis. Sometimes lameness can be caused by wounds that have penetrated into a synovial structure. This may be a joint, a tendon sheath, or a bursa, such as the navicular bursa, which some of you may be familiar with, which is associated with the navicular bone. A synovial structure is a compartment that is lined with synovium. If a wound goes through the skin and enters this structure, bacterial infection may establish itself. Once established, this becomes very painful for the horse to the point where he may be non-weight bearing lame. This can occur via a large wound or a small innocent looking puncture wound. Numerous joints of the horse are very superficial and easily penetrated. There's a few examples down here of where we might find some joints. It's probably a good idea to familiarise yourself with the main ones. But of course, if you're ever worried, just send us over a few pictures and we can look at them for you. So if you find your horse with a wound close to any joint or tendon sheath, then please call your vet. We will examine the horse and decide if we need to take a sample of the fluid from within the structure. This is done in the same way as you'd medicate a joint or block a joint on a lame horse. However, we just remove the fluid and analyse it in the lab instead of putting anything in. We'll then look at the synovial fluid and see if it has any abnormal components in it. Severe lameness won't occur instantly, so if your horse injures himself and he does get a septic joint, he won't initially be incredibly lame. It does take time for the pain to develop. Sometimes it will be the next day, or it can take a few days in some cases, depending on the scenario. We'd advise you not to put any creams or sprays on the wound before we come to see it, simply because this makes our evaluation harder. The best way to clean a dirty wound is just use a hose. Another cause of lameness, fairly common, is cellulitis. We'll just talk briefly about this. This is an infection of the leg, so it's a severe and deep infection that spreads through the dermis and subcutaneous tissues, often ending up with a large, hot, swollen leg. It's often not one particular part of the leg that's swollen, but as you can see in this picture here, it's just swollen everywhere. There's not one particular aspect more than the other, it's just swollen. This will need veterinary attention and we'll usually prescribe you some antibiotics and some anti-inflammatories like bute. And a lot of treatment for cellulitis is done by you guys. So the horse needs walking and cold hosing regularly to help decrease that swelling. And the more you put into it, really, the more you get out. If they can go on a walker, that's great. Turnout's also good as long as the horse doesn't just stand there and graze. They do actually need to be moving. Next, nail in the foot scenario. So you bring your horse in from the field, he's really lame. You pick his foot up and you find a nail. What do you do in this circumstance? Don't remove it, please. This always needs veterinary attention, no matter how quickly you notice it. Of course, there's kind of the scenario in rare cases, if you're there when your horse puts his foot down on a nail, it's only gone in a little way. In that sort of circumstance, then yes, obviously you don't want it going further in, so you would take it out or try and prevent it going further. But in these circumstances, you really need to make note of where it's gone in for us. Usually that won't be the case. Usually you'll find it and it's gone in as deep as it will have done. So it's not really a common scenario, but if it happens to have only gone in a little bit and has potential to go deeper, then do take it out. So we ask you to leave it in place, really, so that when we arrive, we can see exactly where it went and in which direction. We'll take x-rays with the nail in place so that we can see exactly how deep it's gone and which way. This is important because there's many particularly important structures in the foot that can be damaged by these nails. The danger zone, so if you pick your horse's foot up and you find a nail, the danger zone is the central third of the frog, as the nails that enter here are most likely to hit these important structures. Depending on what we find, we'll either remove the nail, dig out the tract, and leave you with poulticing instructions to try and prevent foot abscess formation, or we may refer you to a surgeon if unfortunately the nail has gone in an unlucky direction. So just as this is an x-ray of a foot, of course, with the nail going in. This is the pedal bone here, and then the navicular bone here. And this nail has gone in a fairly okay location. So it's come quite close to hitting the pedal bone itself, which is potentially a problem, but it has avoided the coffin joint, the navicular bursa, and the deep digital flexor tendon, which runs down the back of the leg, should be fine too. So in this circumstance, we'd probably remove the nail, dig out the tract, and poultice. A diagram here again, just showing basically what I've just said. So you've got the distal phalanx or the coffin joint, or the coffin bone or pedal bone here. Coffin joint will be down here, navicular bone and the navicular bursa. Your deep flexor tendon runs down here, inserting onto your bone here. And if a nail should happen to get into the joint or the navicular bursa, that can set up a septic joint or septic bursa, as we just discussed, which does require surgical intervention. Equally, if the the nail goes in, oh sorry, my cursor isn't working, here somewhere, and does touch the pedal bone or the flexor tendon. That can set up infection too. Now, laminitis, been seeing a fair amount of this recently. Depending on the severity of the laminitis, the pony may have a short pottery gait, or maybe unwilling to move completely, or maybe just be lying down more often. They may refuse to pick up a leg if both front feet are affected the same. They won't want to pick one up over the other because it's just more painful. It puts so much weight through the other limb that they just find it too painful to do that. This is an emergency. The horse will be really painful, and failure to manage it can result in worsening of the condition. So as you can see in this stance on the right, this is a characteristic laminitic stance. So they're pushing their weight back into their heels. You'll be able to feel usually increased heat in the feet and digital pulses as you would with a foot abscess. What we ask you to do is put them on strict box rest with a shavings bed that's really deep and goes right up to the stable door. We may remove the shoes if they have any on, and we may pad the feet and leave you with pain relief, usually bute or Danilon. We may suggest taking x-rays of the foot as an indication of the severity of the change and to some extent the prognosis associated with it. Of course, it's important they have no grass, sote only at these times. We want to minimise all sugar in their diet. So this is an x-ray of a horse with laminitis. This here is a marker on the hoof wall, just so we can assess where that is. And of course, this is the bottom of the pedal bone here and the sole. These lines, we normally draw these on once we take the x-rays back to the clinic. And what we're assessing is if there's any sinking of the bone or if there's any rotation of the bone. And of course, here you can see usually this line here, so this green line and this blue line should be pretty much parallel. But here the pedal bone has rotated and now it's pointing down this way. You can see gas shadowing in here, and you can see how close the tip of the bone is to the sole. So that covers lameness. Next on our list is wounds, what to do with wounds. Horses will often come in from the field or out of the stable with wounds. When looking at these, I suggest looking at the whole horse, not just the wound itself. Make sure you check for any lameness or swelling or bleeding, as this may indicate something else is going on. A simple wound should not really cause the horse to be exceptionally lame. It's quite hard to classify wounds into those that need veterinary attention and those don't. However, in a general kind of method of thinking about it, there's a table here which you could use as a guide. So what does almost always need a visit from us is a deep wound that's gone all the way through the skin. If there's a skin flap, then we can usually stitch these. As already discussed, any wounds over joints need a visit, as should those with a lot of bleeding, discharge or lameness or swelling. If an abrasion is present with just loss of hair and some layers of skin, then that's kind of, and that is well away from any joints, then you may be okay without a visit, just cleaning it up and keeping an eye on how your horse is doing. If we are coming to look at the horse, then again, as mentioned, the best way to clean it is just to use a hose to get rid of contamination. Don't bother with silver spray or anything like that until we've had a look, just because we want to see what's under there. And yes, always feel free to send us some pictures. Sometimes it's quite hard to assess on a picture, but we can always have a look and see what we think. So if the wound's over a joint, we've mentioned this already, synovial sepsis and contamination with bacteria, the horse may become very lame, and don't be deceived by puncture. This is an emergency and always call us. If there is hemorrhage, this is sort of an owner's worst nightmare as well, lots of bleeding. Try not to panic, easier said than done, but try not to. It's a good idea to keep a few bits around on the yard that you could use in this sort of scenario. Ideally, you'd apply a bandage with pressure over the site of bleeding. If you do apply a bandage and it seeps through, then don't take it off. Just put another layer on and keep applying layers until it doesn't seep through. This will, of course, need our attention, so do call us as soon as you can, and we'll get to you as soon as we can. It's quite common in wounds of the lower limb, simply because the vessels run really superficially underneath the skin, so it can be quite easy for a horse to lacerate an artery down there. So this picture kind of demonstrates how the person is layering up. So they've put one bandage on, the blood's seeping through, so they're just putting pressure over the site of bleeding and putting another layer on. A little bit more about blood loss. So how much blood does your horse have? 8% approximately of their body weight is blood. So in a 500 kilo horse, about 40 litres. And a horse can lose between 15 to 30% really of their blood, depending on the circumstance and the time over which it's lost, without needing anything like a transfusion. So that's between kind of 6 to 12 litres in a 500 kilo horse, which is quite a lot. It may well look like a lot that's up on the floor or coming in from the field, but often it's not quite as much as you think. To stitch or not stitch a wound. This is a good example here of a wound that has gone all the way through the skin and should be stitched. As a general rule, the sooner we get to see a wound, the more likely we are to stitch it. This is simply because with time, the tissue underneath becomes contaminated and dirty, and it also starts to shrink back and become dry and dead if the blood supply to it's compromised. In an ideal world, we'd stitch all wounds, as this hastens usually healing time. However, if we cannot stitch the wound because it's old, because we want it to be open and draining because there's a pocket in there or something like that, then we leave it to heal by itself, which we call secondary intention healing. If it's in a location that can be bandaged, then we will do to create an optimum environment for wound healing and to protect the wound. The next slide covers bandaging and what would be handy to have around on the yard. So what to have in your bandage box, you want something called a primary dressing, which is like a melalin or a Primpor, to go directly over the wound itself, and then a soft band to hold that in place, followed by a padding layer such as cotton wool or gamgee. You then want a knit firm, which is kind of a cotton weaved bandage that you apply to quite tightly to hold all that in place, followed by vet wrap. What else to have in your bandage box? Poultice material, duct tape, towels, gloves are a really good one as well. So bandaging may seem like a fairly straightforward task, but often causes vets and owners a lot of grief. Bandages are essential in many circumstances. They provide support to swollen limbs, they protect healing wounds, they protect wounds that have been stitched, or protect incisions made at surgery. They can, however, cause problems if not utilised in the correct manner. As we can't tell a horse to stay still, bandages may slip from their initial location with time. When they do this, the bandage then sits in an abnormal position and may cause rubs. Horses have lots of bony prominences, such as the point of the hock or the accessory carpal bone, that are very easily damaged if this should happen. This may seem like a fairly insignificant problem, but actually they can become very extensive, leading to large ulcerations. They may prohibit further bandaging and cause scarring. This is why if your horse requires bandaging for more than a few days, we stress that the bandage should be changed if it slips or if there's discharge and it soaks through. Finer horses, such as thoroughbreds, are more likely to suffer from bandage rubs simply because their limbs are finer. So how to place a bandage, again, here's listed what you need, and there's some pictures on the next slide about what you might need. Briefly mentioned, the only layer that should be applied with any real tension is the knit firm, as this holds everything underneath in place. What you want to do is aim for even pressure from the top of the bandage to the bottom. Only the knit firm should be applied tightly and take care over the bony prominences. What you're kind of aiming for is a cylindrical shape from top to bottom, just so that pressure is distributed evenly. Like I said, should it slip or anything, then it's just best off changed. If your horse is requiring ongoing bandaging, usually it would be preferable if we could come and see it fairly regularly, A, so we can change the bandage for you, and B, so that we can assess the leg itself. However, if this isn't possible for any reason, then please do ask us to explain what we're doing when we change the bandage the first time for you, or even if you want to have a go at it with us present, do ask us, and we're more than happy for this to happen. So here, just some examples of what we will have in our cars. These here, the Allevian, Primapur, Melalin, these are the primary dressings which go on the wound itself, followed by, this is a soft band here, which will hold that in place. We'll then often use cotton to pad it up, and this is the knit firm that's applied tightly, followed by your vet wrap and a bit of E-band at the top and bottom. We'll also have, of course, poultice material in our car and a few other bits to help us out. So that covers wounds. Next is choke. So choke does occur fairly commonly. It happens when the horse gets something stuck in its esophagus. Unlike humans, horses can breathe when this happens. It can be caused simply by a horse eating something large too quickly and not chewing it, or a carrot or something like that. Or it can be caused by poor dentition or other rarer causes such as neurological issues, but that's less common. In most cases, the horse will clear the obstruction in about 10 to 20 minutes. My advice is to place them in a stable with no access to food or water and just try and keep them calm. If the choke clears, so the obstruction, whatever it is, moves down the esophagus into the stomach, then you'll usually notice a quite rapid improvement in your horse's demeanour. What you'll sometimes see when horses are choking is food or discharge coming from the nostrils. You may see the head and neck stretched out. They may be really quiet, or they might be a bit distressed. They may retch or cough. You may see a lump present on the left side of the neck there. So yes, put them in a stable, take away their food and water, and let us know what's going on. Should it have not cleared by itself in 10 to 20 minutes, then we will come out and give you a hand. Quite often, by the time we get there, it might have fixed itself. If not, then we'll usually give them some sedative to encourage them to lower their head, and we'll often give them some muscle relaxants to relax the esophagus and help things pass. We may try to pass a stomach tube to see roughly what level of the esophagus the problem is, and see if it can either be flushed through or gently dislodged. In rare circumstances, where the obstruction is quite severe, there's been a fair amount of trauma to the esophagus, or it's been going on a long time, then what can happen is aspiration pneumonia can develop, which is where food or water particles are inhaled and can potentially set up a bacterial infection in the lungs. If we were concerned about this, then we may well leave you with some antibiotics, but the majority of these don't need it. So this picture here just demonstrates what we do when we pass a tube. You'll more commonly see us do this if we're seeing a colicking horse, but that's basically what we're doing. And finally then, our last topic is allergic reactions. Horses can have allergic reactions to many substances, and often we don't know what the trigger is. What you tend to see is development of these hives or wheals. This may range from 1 or 2 under the belly or on the side or wherever, to extensive wheals all over the body, such as in this horse. They may or may not be itchy. If they are itchy, then the horse may rub itself and cause itself damage, so self-trauma from the itch. If the horse exhibits a severe allergic reaction, as above, with multiple lumps, lots of swelling around any kind of important structures such as the eyes, mouth, nose, or the horse is unhappy with it, then do let us know, because it will need our intervention. Usually we'll give them a steroid injection, and usually this helps them out pretty quick. If they have 1, potentially 2 swellings on the side or under the belly, and they're not bothered by it, then you may be fine with just an advice call. We may suggest you cold hose the area. If you have any non-steroidals to hand, such as some Bute, then we may suggest trying that, and just keeping them in a cool environment. It may often help them. Like I say, usually you don't always know what the triggering factor is, so it's hard to take them away from the allergen itself. But if it's something obvious, then you can try. But usually we're not sure. If it occurs as a one-off, then fine. If it starts to occur on multiple occasions, then it's something we can investigate. And then colic, of course, is one of the most important reasons, or one of the most common reasons we shall come and see your horse as an emergency. Colic just means abdominal pain, so there's something in the abdomen that's causing the horse discomfort. There are many different causes, and I shan't be discussing them today, as we have another webinar coming up at some point, which will tell you all about colic, so keep an eye out for that. References there, and now we've got plenty of time for any questions, should anyone have any. Thank you very much for listening.
Great, Helen, that was really informative. Just give you guys a minute or 2 to get your questions in. I've already got 1 or 2 waiting, and then we'll get started. Perfect. Do feel free to keep talking. I'm just going to run through those first few questions. So I've got a question from Libby here, which is, how do I tell if there's something in my horse's eye?
So if there is something in your horse's eye, or if we're concerned there may be, then what we might do is, there's multiple things we could do. We could put a little bit of local anaesthetic around the nerve that supplies the eyelid. so that temporarily we can stop the horse from moving its eyelid, and we can relax it so that we can have a good feel underneath there. What we'll do is we'll put some topical anaesthetic on the horse's eye itself so that they can't feel what we're doing, and we'll just run a sterile glove underneath the eyelids to see if we can feel anything. We might even take the third eyelid and pull it out and just check there's nothing under there as well, just to be sure.
Perfect. I've got another question from Sarah, which is, if my horse is bleeding, how many layers can I apply?
As many as you can. As many as you can do. Just keep going. You may well run out of bandaging the stuff, but yeah, just as many as you can put on, really.
Perfect. And then a question from Louisa, which is, why do horses get foot abscesses and why are they so very painful?
Well, there's multiple reasons they could get them. Sometimes horses, so the white line is the junction between the wall and the sole, and there can be kind of defects in this line that bacteria can enter through. Once bacteria enter, they can they can set up some pus in there, and of course, because the hoof is a confined capsule, when there's a lot of pus in there, it exhibits a lot of pressure on the surroundings, which will be very sore. There's many reasons horses can get foot abscesses. A nail in the foot could cause a foot an abscess. Should your horse bruise its sole because it's galloping around the field and lands on a stone and gets a bleed in there, that can then turn into an abscess. Horses with laminitis are more prone to foot abscesses, and equally weird and wonderful things like keratomas can predispose to foot abscesses and things like that. But yeah, they're really common, and usually some bacteria has worked its way up under the hoof wall somewhere.
Just a follow-on question from that is about antibiotics and foot abscesses, which I think is quite a common one actually that we get asked. I think often it's very dependent on the depth of the foot abscess and what's coming out of it. The vast majority are sterile, so they don't have any bacteria kind of going up into any important parts of the foot, and it's simply like having almost a blood blister, something that's just in the superficial layers of the sole. Lots of questions about describing exactly how you would place a poultice, kind of talking through the steps and the layers, and I think really highlights the importance of having a follow-up of a practical day, doesn't it, for a talk like this?
Definitely.
If you're happy talking through the steps quickly, Helen, and how you
yeah, of course. So you just want to make sure the sole itself is clean. It's often helpful to have someone with you, either have someone holding the leg and another person putting the poultice on. Have to give the horse a hay net or something to keep him occupied. Front legs are much easier to do than back legs. So you'll start off, when you poultice a foot with an abscess, you'll start off with a wet poultice. You just soak the poultice material kind of square out, roughly the size over the suspected area of abscess or the bit that's been pared away with the hoof knife. To cover that, dunk it in some warm water and then squeeze it out so it's still wet, but not sopping wet. Put that against the hoof. So when you take your poultice material out of the packet, there'll be a kind of a shiny backing, and then another side, dunk the whole thing in the water, give it a squeeze, and then the shiny bit should be facing you when you put it on the horse. And then some people will skip the padding layer. I often put a padding layer on simply because it helps cushion the foot and provide some comfort for the horse. Like I say, you can use a soft band or a nappy, and all that does really also is hold the poultice material against the sole. And then you want some vet wrap to hold it all in place, and then just make sure it doesn't go too tight anywhere. If your vet wrap goes above the hoof wall, then just make sure it's not digging into the front of the pastern or anything like that. And then what you can do before you even start is make a tape square or circle out tape. So just get some duct tape, break off multiple strips and make a pre-prepared square, so that once you've got all your other stuff on, you can put your waterproof tape straight over the hoof. So there's no kind of messing around at that point. And then you can, if you want to, you can put a bit of extra tape around just to secure it in place.
Lovely. Yeah, and it's always something, if you've got any questions when we're at the yard, do just ask us to demonstrate or talk through things. If we come out and see an abscess, we would always help you put the first few poultices on, and we're always around to help do subsequent changes if you need us to. some horses do need sedation, or they're just really, really sore. So we are always on hand to help if need be. And there are a few follow-up questions about kind of when to stop poulticing and whether we harden the hoof off after. I think they're all very case dependent. So dependent on when the discharge stops and how soft your horse's hoof is, how big the defect is, and what time of year it is, whether they're going to go out into a wet field, etc., are all factors. So it's great you're thinking about all of those different aspects, but I think really it's very case dependent and something that your vet will discuss when looking at your specific horse's foot and how big the abscess is. There are quite a lot of questions, so just running through them. For bleeding and kind of those sorts of wounds, people are asking about kind of the pressure and what we want to do. So if you've got a wound that's bleeding quite a lot, very similar to the layers that Helen was talking about, you do still want something quite soft to place on there first to kind of conform to the leg. And then you are just applying the layers exactly as Helen demonstrated. Once you've got bleeding, you need to be quite firm with your pressure, and that's what the additional layers will do. Every additional layer will add a little bit more pressure and a little bit more conforming, I guess, to that, to kind of help put some pressure over that blood vessel and help it to clot. So hopefully that addresses how to bandage a bleeding wound.
Or
if you ever do, yeah.
Sorry to interrupt now. Or equally, I was going to say, if you're out or you don't have these things to hand, you can use a towel or, a jumper or a t-shirt or just multiple things that you've got to hand that can just apply pressure. Towels are often quite good, actually, if you can tie those in place with something. So don't worry too much about it being the correct bandage material or anything like that. You just want something big and bulky that you can attach to the site of bleeding and put pressure against it. Even equally, if you want to stand and push something against it, if we're not far away, then that's an option as well.
Absolutely. And then what do we suggest for eye problems caused by flies? So quite often that will be conjunctivitis, where the eyes are just weeping, and the conjunctiva, so the inner part of the eyes, are just really, really red and sore. It is worth just always having them looked at, just to make sure that is the only thing going on. As Helen explained earlier, there are lots of quite subtle things that can get in the eye, a little bit of grain or other things that can cause ulceration. So always worth having the eye looked at and the eye stained if the vet's got any concerns. Fly masks are brilliant for this. I think probably is the most common. If the conjunctiva is very inflamed, there are lots of eye drops and things that we can put in, but really prevention is the best, isn't it? By having a good quality fly mask and thinking about the time of year and which fields we're using in summer to try and prevent our exposure to flies where we can. And what are the most obvious indicators for an injury to the jaw? So I guess might be that there can be lumps and bumps and foreign bodies where horses have stuck their head into bushes. So very similar with superficial wounds and things that you might see. Helen, can you think of some other reasons?
Yeah, that they may drop food. They may be less keen to eat. They may try. They may try to eat. For example, if your horse has managed to fracture its jaw or it's in incisive bone or something, then it's not going to be willing to pick the grass per se. So I guess any sort of swelling, reluctance to eat, kind of suddenly become head shy, wounds, abnormal contours, anything like that really is probably a best indicator. I'd like to think that, yeah, if it's something major, that will be fairly noticeable, I think.
Perfect. Then we've got, I think, probably a dreaded call from lots of people, a thorn in the leg. So black thorns, especially after hunting and things like that. I would probably say that you'd always be worried about a thorn, even if it's not near a joint, because they can get quite embedded and act like foreign bodies. So they can almost make their own little tracks and sit under the skin. The question is also partly, so I'll read it out. If my horse has a thorn in its leg, when should I be worried? And if it's gone into a joint or tendon sheath, will they become lame really quickly?
So yes, well, if it has gone into a joint or tendon sheath, then 9 out of 10 times I would say this will cause you a problem, and it most likely will end up with so blackthorn, especially hunters coming in from the hunting season that have managed to go over fences and things and get these in their joints. It will cause a marked reaction in the joint, and what we do is we take a sample, as I briefly mentioned earlier, and run that in the lab. We take a sample of the normal fluid in the joint and run that in the lab, and often what we look at is a white blood cell count in there, and that will be sky high, especially with thorns. There's up a marked reaction in there, and then if that was unfortunately the case, it would usually require surgery, so to go into the joint, flush everything out, and sort out any inflammation or infection that has established itself in there. Like Linnea said, also they're quite tricky things where they can migrate their way through the surrounding areas quite markedly. So even if you think it's gone in somewhere, it may end up in a completely different location. And it's probably a good time to mention equally with wounds, if your horse has struck his front limb with his back limb and he's got a skin wound, it may be that it actually, if it occurred when the limb was flexed, you actually have damage to the underlying tissues, which kind of spread either up or down from the initial wound, simply because if the limb's in motion or flexed or something when the injury occurs, the damage may be surrounding, and there may be more kind of tracks or underlying damage in the surrounding areas instead of simply underneath where the exact wound is.
Correct. And then one more question about wounds. Is it advisable to bandage the wound to stop it swelling, or icing the wound before the vet has seen it, just in case it might need scanning or further investigation? So I think that's quite a difficult one, isn't it, really? Very case dependent.
Hosing it definitely won't do it any harm. So yeah, if there's swelling there and there's a wound there, then hosing it is a good thing. It does decrease the inflammation, and especially if you've got something like, with regards to the scanning, something like a bowed tendon. So they've come in from work or something, come in from the field, and they've got a big swelling on the back of their cannon bone, and you suspect a bowed tendon, then swelling is the correct treatment for it, as is ice and rest. In that sort of circumstance, we may not scan it at the time, simply because if you leave it a bit of time to scan it, the lesion itself, you can assess it more fully. So probably, in answer to your question, yes, icing and hosing is usually a good thing to be done. Always, you can give us a ring and tell us what's happened, and then we may be able to suggest if we think that's necessary or not. But yeah, certainly in most cases shouldn't do any harm.
Perfect. So we've had quite a few questions about things to have in a first aid kit and where you can get them from. So we do a first aid kit at Scott Dunn. So they all kind of come in one quick little bag. Pretty much, I'd say Helen summarised really nicely the things that you want in there. So your thermometer, your bandaging material, just all of those sort of things, nice and handy, your towels and gloves and what you would kind of need in that first little instance. So you can get some of the other items elsewhere, but if anyone is interested, do just call reception and they'll get one of those sent out to you. It's really handy having it all in a box or in a quite small little thing that you can travel with you. So if you're going to a show, you're going out packing far away, it can just fit in your lorry, and you've always got what you would need, and you can travel it around with you. Just give everyone a chance for any last little few questions, but I'll make sure I haven't missed any as well. Right. Lovely. Thank you all so much for joining us. It's a really interesting talk, Helen. If you think of any other questions later, do just pop them in to us either via email or give us a ring, and I'm sure one of our vets will happily talk you through any more specific questions you might have.
Perfect. Thank you all very much for listening.